Good afternoon, everyone, and welcome to today's Council on Black Health webinar entitled Expanding Healthy Food Retail in Black Communities, a Review of Strategies and Their Public Health Impact. Today's webinar is the second in the Spring 2020 webinar series offered by the Council's Solution to Diabetes in Black Americans Core. This core is part of the NIH-funded Center for Diabetes Translation Research at the Washington University in St. Louis. The Solutions to Diabetes in Black Americans Core provides methodological and content expertise to advance the field of diabetes research in Black Americans. We really appreciate you joining us, especially during these challenging times. My name is Tiffany Eaton. I am a doctoral candidate and research assistant at the Dornsife School of Public Health at Drexel University, where the council is based. Currently working with Dr. Shariki Kumanyika, the founding chair of the council. I will be your moderator today. The Council's mission is to develop and promote solutions that achieve healthy Black communities. We leverage the credibility and perspectives of Black American researchers, other collaborators, and research partners to facilitate relevant, community-engaged, actionable strategies that positively impact Black communities. Today's session will discuss food retail in Black communities. We will hear current evidence on the feasibility and acceptability of local and national strategies to expand healthy food retail in low-income Black communities, and also studies that evaluated the impact of these strategies on healthy food availability, food purchasing behavior, diet, and health. During the presentation, we ask that you post questions using the Q&A button in the Zoom webinar interface. We will review and select questions for our presenter to respond to after the presentation. If your question was not selected for response, we will share follow-up feedback after today's session. Please feel free to also use the chat window to interact with fellow attendees during the session this afternoon. Today's presentation will be recorded and archived for future viewing. We will publish the webinar online and share the link via email. Our esteemed speaker today is Dr. Chelsea Singleton. Dr. Singleton is an assistant professor of public health in the Department of Kinesiology and Community Health at the University of Illinois at Urbana-Champaign. She earned an MPH in epidemiology from Tulane University in 2011 and a PhD in epidemiology from the University of Alabama at Birmingham in 2015. She completed a research-intensive postdoctoral research fellowship at the University of Illinois at Chicago. Her research examines the impact healthy food retail has on food purchasing, dietary intake, and chronic disease risk in low-income minority communities. She primarily utilizes epidemiological, spatial, and community-based participatory research methodologies to accomplish her research aims. Dr. Singleton, I now invite you to proceed.
All right, thank you so much, Tiffany, for that great introduction. And I'm so happy that everybody is able to join my presentation today. I'm going to be talking about something I'm very passionate about, which is healthy food retail in Black communities. I'm going to today walk you through a number of strategies that have been implemented in the last decade or so, and then I'm going to be talking about their public health impact. So let's go ahead and get started. Okay, just a little bit of background information. I'm not going to go too much into detail about this just because I really want to focus on the strategies and jump right into that. But for decades, several research studies have documented disparities in the availability of affordable, healthy foods in the United States. And I like to really emphasize affordable because when we're thinking about putting strategies in place to expand healthy food retail, we want to make sure that we're putting solutions in place that that really align with our target population. So for an example, if we're targeting low-income Black communities, we want to make sure we're putting strategies in place where we expand healthy food retail, but also we want to make sure that the options are affordable because, there's evidence that shows that, many fresh or healthy staple foods, depending on where you buy them from and depending on what community you're in, they could be expensive. So we want to make sure we're putting affordable strategies in place, strategies that are easy and more accessible to our target population. And research shows that low-income Black communities are disproportionately affected by disparities in healthy food access. And healthy food access, both healthy and unhealthy, I really like to emphasize unhealthy as well, even though today I'm going to be talking solely about healthy food retail. Unhealthy food retail is also very important in this conversation because it's also a very strong marker of these community level outcomes, these adverse community level outcomes such as obesity, obesity rates, as well as diabetes rates. But food access has been linked to poor dietary behavior such as fruit and vegetable purchasing, fruit and vegetable intake, and in some cases has been linked to obesity and type 2 diabetes. So the retail food environment is considered a social determinant of health. And for that, in the last decade, there have been several local and federal entities and even at the state level, making the goal of eliminating disparities in healthy food access a key priority. So many strategic plans that you might see from various different agencies, whether it be at the federal or the local or the state level, they're really making the goal of eliminating healthy food access disparities in our country a key priority, which is wonderful. So as a result, so many strategies have been tried in the last decade or so. And there's just this surge of research that's been coming, that has been conducted, and papers that have been published on this particular area. So I feel like this is a great time to have this conversation about strategies to expand healthy food retail. I want to emphasize or really show what's going on in the Chicago area. So I'm in Illinois, I'm in the Urbana-Champaign area, which is central Illinois. But for 3 years prior to starting my position at the University of Illinois, at Urbana-Champaign, I worked in Chicago as a postdoc. I postdoced at the University of Illinois Chicago, and I worked with the Illinois Prevention Research Center. So a lot of the research I'm going to show you today and some of the findings, it's going to be heavy on Chicago and in the state of Illinois. So I really want to give you a little bit of background information about what's going on if you're not very familiar with the Chicago area. So Chicago is one of the largest urban centers in the country. There's about 77 community districts, and one thing that's very interesting about Chicago is that it actually happens to be one of the most racially segregated cities, urban centers in the country, meaning that many of the neighborhoods have a large proportion of one specific race or ethnicity. So this particular figure is a little dated at this point, just because I know for a fact that there's been several new grocery stores and supermarkets that have opened up in the Chicago area. However, it's still very relevant to the situation in Chicago right now. As you can see in this figure, on the left side of the figure, it shows you all of the communities in Chicago that are considered food deserts. So they have low access to a grocery store or a supermarket, someplace that sells a full line of staple food items such as fruits, vegetables, meat, seafood, breads, grains, dairy, so on and so forth. Those are considered staple foods. So these areas in red are considered the food deserts in Chicago. But if you look to the right part of the figure, all of the tracts that are in all of the neighborhoods that are in red, as you can see, we show you the racial composition of these particular neighborhoods. And as you can see, many of them are mostly African-American neighborhoods. So the issue of food deserts in Chicago is an issue that's very much so relevant to the Black communities of Chicago, mostly on the South Side and the West Side. So as a result, a lot of the initiatives that have and the efforts that have taken place in Chicago to expand healthy food retails, a lot of it is going on in the Black communities on the South and West sides of the city. So I'm going to talk to you specifically about some work that we did at the Illinois Prevention Research Center in Chicago. And many of the communities we work with are actually on the west side of Chicago. So just giving you a little bit of background information about that, since I want to talk about Chicago a lot throughout our presentation. Okay, so I'm going to walk you through 4 strategies today. I'm going to briefly touch on each one. So I'm not going to go into extensive detail about each one, but I'm going to give you a solid overview of each strategy, show you some examples, highlight a little bit of research, and then I'm going to summarize what we know about these strategies in terms of public health impact. And I'm going to define what I mean by impact in a minute. But the 4 strategies I'm going to walk you through are food financing initiatives. Some great examples of food financing initiatives are the Healthy Food Financing Initiative, which took place at the federal level, the Pennsylvania Fresh Food Financing Initiative, which took place at the state level, which is actually sort of a precursor to the federal Healthy Food Financing Initiative. It came before the HFFI. And then another great example would be something, you know, more local, like the LA Healthy Market Network, which is something a little bit more grassroots, a little bit and just solely taking place in the city of LA, where they are leveraging funds to expand healthy food retail locally in low-income minority communities of LA, which has been amazing. And I know several people who are out there working in LA doing this work, and they've had some great results. So I'm going to summarize the evidence on food financing initiatives. I'm going to talk quickly about food package revisions, which is a strategy that really targeted one specific population, and that was the WIC population. So for those who are not familiar with WIC, but WIC is a federally funded food assistance program that targets low-income pregnant women, postpartum women, and children under the age of 5. So I'm going to talk to you about how the WIC food package revisions that took place in 2009 resulted in the expansion of healthy food retail in underserved communities. I'm going to talk about minimum stocking requirements. And minimum stocking requirements, some great examples are the SNAP retailer stocking requirements, as well as the Minneapolis Staple Food Ordinance, which is a piece of policy that only took place in Minneapolis, where they implemented minimum stocking requirements among food stores in the city. And a lot of what we know about minimum stocking requirements has come out of the University of Minnesota STORE study. The PI of that study is Dr. Melissa Laska. You might be familiar with her work, but they definitely have produced a lot of the evidence about what we know about minimum stocking requirements. The final strategy I'm going to walk you through is nutrition incentives. So nutrition incentives are when we offer low-income populations some type of financial incentive for them to purchase more fruits and vegetables or more staple foods. Many of these programs are funded by the USDA's GUS-NIP program, and many of them are implemented at farmers markets. So I'm going to show you how these programs result in the expansion of healthy food in low-income communities, and then summarize what we know about them. Okay, so assessing impact. I'm going to focus my discussion around the evidence and what we know about the impact of these strategies to these sets of endpoints. So what I mean by endpoints, I mean common outcomes. So in this area of research, once the strategy is implemented, we want to know what sort of impact it's having. We want to know, one, is it doing what it's supposed to do, which is expanding healthy food access? That's the first. Okay, so some measures of healthy food access are store offerings. So that means we can go into stores to see if they are actually stocking more healthy foods. We can also look at density and proximity. So we can look at the density of healthy food retailers and stores and their proximity to residents' proximity to these stores. We can look at food purchasing behavior. That's another common set of endpoints. So we could assess what people are actually buying after these strategies are put into place. Are they buying healthier foods? Are they making better selections about stores? Are they choosing to shop at the healthier retailer now that retailer is available? Another set of endpoints is dietary intake. So of course, once we put these strategies in place, we want to know whether or not it translates to actual improvements in diet. So some common measures that you might see in research studies is diet quality. So we want to know, does your overall diet improve? There are several different measures of diet quality that are used in these studies, including the Healthy Eating Index, which was developed in part by the USDA. We can also look at specific components of diet, like fruit and vegetable intake or nutrient intake. So that's also a common endpoint in this area of research. And then finally, health. So some particular marker of health or chronic disease risk. So often we see obesity status. Researchers might collect data on BMI of the population. So In this presentation, I'm going to walk you through all the strategies, and I'm going to summarize what we know about all of these endpoints. You know, just a quick summary. What do we know about how these strategies are impacting healthy food access, and then purchasing behavior? Are people purchasing healthier food? And then dietary intake, is it translating to dietary improvements? And then finally, actually improvements in health. So that's going to be the process and the flow that I'm going to walk you through for each of the strategies, okay? Let's start with food package revisions, okay? So again, like I said, this particular strategy is very much so, it targeted the WIC population. However, it had broader impact beyond the WIC population. So first, the strategy goal was to increase the overall healthfulness of the WIC food package. So some researchers, you might have done some work in this space, or remember that in October 2009, the USDA revised its WIC food package. And the revisions included more nutritious foods and food groups, such as fruits and vegetables, whole grains, low-fat milk, those particular types of items, okay? If you are a WIC participant, there are different food packages, you know, depending on your status. So if you're a pregnant woman, if you are a postpartum woman, breastfeeding or not breastfeeding, or if you're a child, there are specific food packages that have been developed to make sure that the nutritional needs of these populations are being met. So if you are a grocery store, or if you're a corner store, no matter what type of store you are, if you want to accept WIC benefits, you have to stock the food items that are in the WIC package, okay? So when WIC decided to change its food package, many WIC authorized food stores had to increase their healthy food offerings. So that resulted in an expansion of healthy food retail in many low-income communities. And there's evidence that showed that it actually resulted in an expansion, because there are people who shop at grocery stores that are WIC authorized that are not participants of WIC. So this had an impact beyond the WIC population. And several observational studies and natural experiments evaluated the impact of the revisions. I'm definitely going to say, out of all the strategies I'm going to talk about today, this particular strategy has probably the most amount of literature and the clearest literature out of all the strategies. And there's literature from all regions of the country represented, which is great. I want to emphasize one study. So I didn't participate in this study because I was still a PhD student at the time, but there was a great study that was conducted at the University of Illinois, Chicago. My postdoc mentor, Dr. Angela Odoms-Young, was one of the investigators of this particular project, where they wrote several papers assessing the impact of the WIC food package change on the diets and the food purchasing of African-American families as well as Hispanic families in Illinois. They recruited most of their participants from local WIC clinics. And I think that, most, if not all of their participants were from the Chicago area. The reason why I really wanted to emphasize their work is because I like that in almost all of their papers, they present their findings stratified by race, ethnicity. And that's one of the real challenges of my area of research. And I'm actually working on a commissioned paper, a paper that was commissioned by HER, that emphasizes the lack of findings by race, which is a challenge. So we do data collection, but oftentimes we don't present our results in a manner where we can draw conclusions about racial and ethnic differences. So their particular study, a lot of their papers, they present the findings for the Hispanic families separate from the African-American families, so we can really draw conclusions between the groups. So in this particular paper, which I think was their 6-month paper, so between their baseline and then 6 months after the WIC food package went into place, they actually did find some significant, increases in home food availability. So what was available in the home of their study participants in terms of healthier food. So they didn't see anything with fruit, but 100% fruit juice, vegetables, whole grains, as well as low-fat milk. And they saw a decrease in home availability of whole milk. On the diet end for this particular study, and like I said, I have the paper here so you can go read the entire study, but they only saw minimal changes in the diets of children. So I believe they did see increases in low-fat milk consumption of children, but I don't think they saw significant findings of, I don't think they saw significant findings for fruit and vegetable consumption among either Hispanic or African-American children in their studies. So, okay, so what is known and what's unknown? Based off the literature, what we do know is that the WIC food package revision resulted in greater healthy food availability in WIC authorized stores. That trend can be seen across much of the literature, okay? So if you pull out all the papers that really focused on whether or not the food package revision resulted in an expansion of healthy food retail, it actually achieved that goal. So more healthy food offerings in WIC authorized stores, okay? There is a trend among the literature that shows that more healthy foods and food groups were purchased among WIC participants, which makes sense because the food package now included more nutritious food items and food groups. For an example, one key addition to the revision was they added a fruit and vegetable voucher. So because of that, WIC participants can now purchase fresh fruits and vegetables with their WIC benefits. So as a result, it improved food purchasing behavior among WIC participants. The dietary intake data was a little bit, the dietary intake literature is a little bit mixed. However, I did find a few studies. There's a few studies that have been published that found and reported improvements in diet quality among children. However, these findings are a little bit mixed. Like I said, that 6-month paper that Angela's team published did see some they didn't see as many improvements as they probably expected, specifically in the areas of fruit and vegetable consumption. And then finally, there isn't much out there on obesity. So there has been one paper that was published. It was published in 2019 in pediatrics. Yes, it was published in the Journal of Pediatrics, and it tracked obesity rates of WIC children before and after the WIC food package revision, and they did see that obesity rates stabilized among WIC children after the revisions. So pretty much this is what we know about this particular strategy so far, and this is probably, as you're going to see among all the strategies I'm going to talk about today, probably the most we do know across all of these different types of endpoints, okay? All right, let's talk about minimum stocking requirements. So minimum stocking requirements, the goal is to expand healthy food retail in small food stores, okay? Usually the goal is to expand healthy food retail in all stores, but this type of strategy is really focused on smaller food stores, okay? And what I mean by small stores, I mean stores like dollar stores, such as Family Dollar, Dollar General, convenience stores, bodegas, gas stations, pharmacies, liquor stores. These are all considered smaller, non-traditional food stores because they often don't carry a full line of groceries. And that's the major concern. Many low-income Black communities, if they might lack a grocery store, but also just have an overabundance, like a large number of smaller food stores that actually carry food and accept SNAP benefits, but they don't have, they don't carry or stock many healthy foods. And then also the community might not have a grocery store or a super center or a supermarket. So that's the biggest concern. And by putting in minimum stocking requirements, we can address that concern. So usually this is something that's mandated or mandatory. Both of these examples are mandatory, that requires compliance among stores, okay? So I'm gonna talk about the USDA SNAP retailer stocking requirements, since me and my colleagues have done a lot of research on that particular strategy or that particular process. The USDA, they proposed to enhance their SNAP authorized retailer stocking requirements. And they put this in a 2014 Farm Bill and started working on it. I'm kind of walk you through the whole saga of them trying to get this approved, but ultimately did not go through the way that they wanted it to go through, okay? All right, so if you're not familiar with stocking requirements for the USDA, if you are a store and you accept SNAP benefits, you have to stock a certain number of actual USDA recognized staple foods. And I have the staple food categories listed here: fruits and vegetables, meat and seafood, bread and cereal, dairy. Okay. So in the four USDA staple food categories, you have to stock a certain number of varieties and a certain number of stocking units. Okay. Before they started this process of enhancing their requirements, they only required 12 stocking units. Okay, that the bar was set pretty low. And what I mean by a stocking unit, I mean a gallon of milk, a loaf of bread. The stocking, the units or the requirements for stores was pretty low. So they wanted to expand their stocking requirements, you know, and pretty much send the message that if you accept SNAP benefits and you participate in the SNAP program, if you are a retailer, you need to stock healthy food. Okay, so they wanted to increase their stocking requirements for the stocking units to 168. Okay, so that's what they proposed to the public. And ultimately, after receiving public feedback and public comments, they reduced it down to 84. So that was the final rule that was supposed to go into effect. And during this time period, there were some changes to Congress. We had a presidential administration change because a lot of this started during the Obama administration. And what was enforced was actually 36 stocking units. So in the research community, for individuals like myself and my colleagues who were studying the impact of the changes to the stocking requirements, many of us considered this, you know, I wouldn't say a failure, because, you know, it did improve from 12 to 36, but it didn't go through the way that we thought it was going to go through. Okay, so just know that. All right, so I'm going to present you some findings from our research on evaluating the proposed and the final stocking requirements. We actually published a brief. This is a brief that was published by the Illinois Prevention Research Center. It's publicly available on the Illinois Prevention Research Center's website. We actually went into 3 low-income Black communities in Chicago. They were Austin, North Lawndale, as well as Inglewood. All those communities are on the south side or on the west side. And we actually did an assessment of the stores and whether or not they were either going to meet the proposed rules, which is the 168 stocking units. And we found that only 22.1% of the small food stores that we audited were actually meeting that proposed requirement. So if you want to read anything about this particular assessment that we did, like I said, this is publicly available, or if you shoot me an email, I would gladly send you this particular research brief. We then partnered with several researchers at the University of Tennessee to start planning a multi-site national assessment of the final rule. And we actually developed a tool that's also publicly available online to assess stocking in stores. And you can use this for any type of research project. It doesn't have to be a research project about minimum stocking requirements. Okay, so just to quickly show you what we found in our national assessment, we had 9 universities in 7 states collecting data about the final rule. That was the 86 stocking units, and our team at UIC was the coordinating site. And we ended up auditing 351 stores in low-income, low-access communities. All the stores in Chicago, again, were low-income Black communities from our site. And ultimately, across all of the stores, we ended up finding that only 30.5% of stores were actually meeting the final rules, which was the 86 stocking units. And this particular paper was published in a special edition about food access among low-income populations in translational behavioral medicine last year. So if you want to read this paper, I would gladly send it to you. All you have to do is shoot me an email, but it's available in the literature. So what do we know and what do we not know about minimum stocking requirements? Okay, I'm gonna summarize all the literature, not just from our studies, but also from, like I said, the studies that came out of the University of Minnesota with the store study. We do know that if we put minimum stocking requirements in place and stores actually comply, it results in greater healthy food offering in stores. We know that. So it does its job at expanding healthy food retail, but stores have to comply. Compliance is an issue. And that's something that is discussed a lot in the papers that were published by Melissa Laska's team. Compliance stores have to be compliant, but then also there has to be something in place to make sure that stores are compliant. There's a process in place. And from my understanding, just studying the USDA stocking requirements, it just looks like that, you know, the process of making sure stores are compliant is not as strong as we would like it to be. The evidence around food purchasing behavior is minimal. The outcomes papers from the store study were just published last year. I know Dr. Laska sent me the papers to read, and they found minimal changes in food purchasing behavior. And I don't think there are papers about diet have come out, but overall, there's insufficient evidence in the literature for diet, health, and I would even say food purchasing behavior as well. So all we do know is, you know, whether or not stores are expanding their offering among the stores who are compliant, and then, you know, the ones who are not compliant, many of them haven't expanded their stocking requirements. So, but yes, so this is the issue with this particular strategy, okay? But also these particular strategies tend to get a lot of pushback, okay? So I know some qualitative papers, and I can direct you to some qualitative papers that actually summarize store owners and store managers' views about stocking requirements and whether or not it's even feasible from a infrastructure point of view and how it affects their business. So there's a lot of qualitative research on minimum stocking requirements that will be good to read if you want to really understand how this strategy works and whether or not it's even feasible. Okay, so, but that's pretty much all we know about minimum stocking requirements. Happy to discuss more though, if you have any questions. Okay, let's talk about food financing initiatives briefly. All right, so I would definitely say out of all of the strategies I'm going to talk about today, this one I feel like has, these types of strategies definitely have the ability to have the greatest widespread impact on the retail food environments, okay? The goal of healthy food financing initiatives, or financing initiatives in general, is to increase healthy food availability in food deserts by establishing or revamping existing retailers, okay? So many of these initiatives, what they do is that they leverage funds. So they raise funds and then they leverage funds to actually build new healthy food retailers. So they might flat out build a brand new supermarket in an area that's considered a food desert, or they might revamp an existing retailer. So they might take an existing food retailer that's in a low-income Black community, and then they might give them the tools and the education, and then, you know, revamp their store so that they can be considered a healthy food retailer and stock an adequate amount of healthy foods, okay? There's been some great examples of this around the country. I have a few listed here. I'm going to talk mostly about the Healthy Food Financing Initiative because some of the work we've done in Illinois focuses on the Healthy Food Financing Initiative. So I feel like I'm most knowledgeable about that particular initiative, but I definitely recommend you read some of the papers that have come out of Pennsylvania, because like I said, they had a fresh food financing initiative before the HFFI actually was developed. And there's been a lot of briefs, papers, as well as reports that have come out of Pennsylvania. Many of them were produced by the Food Trust to actually show the widespread impact of the Pennsylvania Fresh Food Financing Initiative, not just on healthy food availability, but also on the economy, like the economic impact of these types of initiatives, which is very important. But the Obama administration announced the Healthy Food Financing Initiative in 2011. This was a joint partnership from several different components of the federal government, including the U.S. Treasury as well as the USDA. And since the HFFI started, it has funded over 1,000 healthy food retail expansion and projects in 35 U.S. states, which is amazing. And it has resulted in tens of thousands of square footage of healthy food retail space added to low-income communities that are USDA designated food deserts since the start of the initiative. So it's definitely had some widespread impact across the country. I'm gonna talk to you specifically about the Chicago Community Fund, the Chicago Community Loan Fund's work, because they applied and received funds from the HFFI and then leveraged those funds and made partnerships in Chicago with the grocer to bring a new supermarket to a low-income Black community in Chicago, and that community is Inglewood. And at the time, Inglewood it did not have a supermarket for a while, so it was considered a food desert. All right, so in late September of 2016, one of the first, Whole Foods opened a grocery store in Chicago, on the South Side in the Inglewood community. And it's actually one of about, I want to say 2 or 3 Whole Foods markets that are open, that are located on the South Side of Chicago. I know there's one in Hyde Park, but Hyde Park is not really considered a low-income community. And I think there might be some on the far South Side, but there are several Whole Foods markets on downtown and on the north side of Chicago. And there were very few, if not 1 or 2 on the south side of Chicago, but there were definitely none in any low-income Black communities on the south side. So this is the first Whole Foods market that opened up in this particular area for South Side residents. So like I said, it opened for business in late September 2016. And as you can imagine, it got a lot of press. This is actually a snapshot from one of the articles that was published about the Whole Foods market that opened on the South Side. So we did some research around this particular Whole Foods market. This was actually part of a larger CDC-funded no-print project from the Illinois Prevention Research Center. And the PI of this project is one of my postdoc mentors, Dr. Lisa Powell. And I worked on this project as a postdoc the whole time I lived in Chicago. But we wanted to see how these markets were going to affect the existing retail food environment in these communities, which were comprised mostly of small stores. Again, small, non-traditional stores, because they did not have a market. They did not have a supermarket prior to that. So as you can see, Inglewood is almost completely African-American and has a large number of residents that are considered to be impoverished. So that means that they live at or below the federal poverty line. And our study is a natural experiment. Each one of our sites that received a grocery store actually had a comparison site. But you can read our baseline paper about this project, as well as my follow-up paper about the Rockford sites. They both have been published, and I would gladly share that information with you. I really wanted to show you just a snapshot of fruit and vegetable availability in these communities and in the Whole Foods market. So we actually audited the Whole Foods market to see what they were selling and what they were advertising. We have a whole advertising marketing component of the research. And we have, we looked at fruit and vegetable options by presentation, so fresh versus frozen versus canned. We assessed the whole food market, and then all of the small food stores we found in Inglewood and North Lawndale. When we audited Inglewood, we found 40 small food stores in the area. So 40 of these non-traditional stores, which was concerning because, the community did not have a grocery store prior to the Whole Foods market opening. So, there was 40 stores selling food, and many of them accepted SNAP, but they were carrying very little fresh fruits and vegetables at baseline and our follow-up period. So we had 2 follow-up periods. We did the follow-up data collection in 2017 and 2018 to see if we saw any significant changes, and we did not. So as you can see, many of these stores were averaging less than 3 fresh and frozen fruit and vegetable options. So what do we know about fresh food or food financing initiatives, not just the HFFI, but all the food financing initiatives that have been conducted to date? Again, they achieve their goal. They expand healthy food retail space in target communities, which is great. So that's the first goal, making sure that it actually does what it's supposed to do, which is expanding healthy food access. If you look at whether or not that's translating down to food purchasing behavior, this is sort of where it stops. When looking at the impact of the grocery stores, several studies have reported no change in food purchasing behavior of community residents, okay? So no significant changes in the actual food purchases, what people are buying. If you want to look at the smaller stores, revamping smaller stores, there have been modest improvements in food purchases in smaller stores. So if you like sort of the corner store initiatives, the smaller market initiatives, they're seeing greater sales and greater purchasing among the users of those smaller stores, but not in the grocery stores or in the communities surrounding the grocery store. And then also no changes in dietary intake have been recorded. Okay. And then there's very much so insufficient evidence on health. So that's pretty much all we know right now about food financing initiatives. In my last few minutes before we take Q&A, I'm going to summarize what we know about nutrition incentive programs and talk to you about this strategy and what we know about these particular strategies. So nutrition incentive programs, the goal of these types of programs are to make healthy food more accessible by offering nutrition incentives. Okay, so what we mean by nutrition incentives is we are offering low-income populations an actual monetary incentive for them to go to a retailer. It could be a farmer's market, it could be a supermarket, to actually purchase healthy foods or staple foods. Some of these programs have different stipulations. Some programs only allow people to purchase fruits and vegetables with their incentive benefits, and some will let you buy any type of SNAP eligible food. Okay, so it just depends by the program and who's running the program. But over the last 10 to 20 years, there have been several programs that have been developed around the country. Link Up Illinois, or we call it Link Match now, is the biggest program in the state of Illinois. Double Up Food Bucks is also in the Midwest, mostly Iowa, mostly Michigan. Wholesome Wave is down south. I think Wholesome Wave started mostly in the Georgia area. So these programs are around the country because the number of farmers markets and incentive programs have grown exponentially over the last few decades. So many of these programs are supported by the USDA's Gus Shoemaker Nutrition Incentive Program. Many of you might know this program as FINI. So it used to be called the FINI program. And in our state, my partners at Experimental Station, they get money from Gus Shoemaker, the Gus Shoemaker program, to actually operate Link Match. And currently Link Match is at over 85 farmers markets and direct produce vendors in Illinois across our state, which is pretty amazing. And like I said, these programs have different guidelines. They have different stipulations depending on where you are and what program you're operating. But here in Illinois with Link Match, what we do is that we offer our SNAP recipients, a match. So up to $25. So you have to use your SNAP benefit. So you can go to any participating farmers market. If you spend $25 of your SNAP benefits at the market, or up to $25, we'll match that dollar amount. So you can end up taking home double the amount of fresh staple foods, locally grown fresh staple foods, which is amazing. So they're a great program. Okay. And just want to emphasize how these programs expand healthy food retail. Because these programs, oftentimes there has to be a partnership with the retailer. For an example, here in the state of Illinois, we're trying to pilot Link Match in grocery stores in our state. Right now, we're planning a pilot in the Chicago area. But with that pilot, we're partnering with grocers who are going to agree to carry a minimal stock of fresh fruits and vegetables. And many of these fresh fruits and vegetables have to be local to the Midwest. They have to be local to Illinois. They have to be local to the Midwest. So grown by farmers in the Midwest. So if grocers want to opt into this program to offer Link Match and increase their number of SNAP participants, they actually use their store, they have to agree to carry a certain amount of fresh fruits and vegetables. So bringing these programs into communities expand healthy food retail because of that. Plus, they also make these foods more accessible to our target population, okay? So I've done some research with my partners at Experimental Station. This is actually findings from a paper that we published in January of this year, where we were studying racial ethnic disparities in farmers market usage, Link Match program usage between SNAP participants in the state of Illinois. Many of the people who participated in this assessment live in the Chicago area, and many of them are African American. We had a pretty good split in terms of race. So again, we were looking at racial ethnic differences, and this is just some descriptive information about our study population. And we had about 20 or 22% of our study population were consuming fruits and vegetables on a daily basis. So I'm going to, emphasize what we found in terms of the disparities in fruit and vegetable consumption. So we actually found significant disparities between by race for our target population. Again, we were looking at SNAP recipients in the state of Illinois, these participants who are using the link match program. So among link match users, we saw racial ethnic disparities in usage of farmers markets. For an example, our Black study participants use farmers market less. They purchase a fewer amounts of food and spent less dollars at the farmers markets than our white participants. So our white participants were considered the reference group. And they also had lower odds of consuming fruits and vegetables daily. So that's what you see here. So these are our odds ratios from our logistic regression models. And as you can see, we have lower odds among Black and our other participants. And mostly our other participants were, in this particular study, were mostly Hispanic. So we did find racial ethnic differences in the food purchasing behaviors or utilization of the incentive programs, as well as the fruit and vegetable consumption. So if you have any questions about these findings, I'm happy to share the paper with you. Again, it's available in the literature. So what's known and what's unknown about nutrition incentives? So I'm gonna state this and then I'm gonna wrap it up and we can take questions, but retailers often opt into these programs, which is great. If they feel like it's going to be a program that's going to help help the community, and it's something that's going to be financially viable for them, it's not going to be a financial burden for them, they often opt into these incentive programs. They want to offer them and use them and offer them to the community. However, I found both public health research as well as sociological research that shows that they're underutilized in Black communities, definitely underutilized in Black communities. And what I mean by underutilized, I'm speaking specifically about the programs, about the nutrition incentive programs, okay? For the example, in the city of Chicago, there are farmers markets all across the city of Chicago. There are some on the south side of Chicago in our low-income Black communities, but they often get less foot traffic. They often get lower amounts of SNAP redemption, lower amounts of usage of the link match program. And there's data, Experimental Station, my community partner, have data that shows that. They actually see more SNAP redemption and utilization in our downtown farmers markets and farmers markets in other areas outside of the low income Black communities, which is interesting. We see greater fruit and vegetable purchasing among users of these incentive programs. We see greater fruit and vegetable intake among users of these programs. And we've even seen lower BMI among users of the program compared to non-users of the program. However, I will say this, and I put this in brackets just to highlight this. A lot of the evidence that comes out of this area of research, we're looking at cross-sectional studies with very small sample sizes. Oftentimes they don't have a proper comparison group, meaning that they don't have a good group of non-users that are considered a really good comparison group. So I will say that the evidence in terms of methodological quality for this area of research is a little weak. However, at least there's some literature on almost all of these endpoints. Okay. So to wrap up and start Q&A, strategies to expand healthy food retail often lead to improvements in actual and perceived healthy food access in low-income Black communities. So I just want to emphasize that, I personally feel very passionate about this area of research just because of the social and the food justice issues. So even though we might not see the improvements we want to in food purchasing, diet, and health, I do believe that these strategies address key social and food justice issues, which is very important. We want to make sure that communities of color in this country actually have the tools they need to be healthy and eat healthy if they choose to eat healthy. So again, addressing those social and food justice issues by making sure communities actually have healthy food retailers and available for residents to patronize. However, the findings on food purchasing behavior, diet, and health, they have some limitations, or they're weak, or they are insufficient. And again, variations exist by strategies. There's some strategies that I discussed today we know more about, some we know less about. But the last thing I want to say before we start Q&A is that I really want to emphasize that there's very little research about inequities in implementation and effectiveness by race, ethnicity, and I'm also going to say socioeconomic status. Okay, so what I mean is that there's little that we know about when we have these strategies and we're implementing them across, let's say, the entire country or city. Are they implemented the same across communities based off racial ethnic composition? Do they have the same effect across communities based off of racial ethnic composition? So that's something that I'm very interested in terms, but I guess that's more on the implementation side, more implementation research. So, but no, that's a key gap in knowledge that I'm hoping that we can fulfill, moving forward in this area of research. So I'm going to stop there. Say thank you to Tiffany for all of her support, as well as Dr. Kumanika for the invitation to present for you today. If you want to connect with me, I have my email here. You could also follow me on Twitter, Dr. CR Singleton. I'm happy to connect with you about my research, but thank you.
Awesome.
Questions?
Yep, so we are now going to invite our participants to post questions using the Q&A button in the Zoom webinar interface. We do have a couple, but if you have some, please post them. So Dr. Singleton, our first question is, what are your thoughts on the utility of USDA Food APS dataset that offers data on household level food acquisitions on a nationally representative sample and on providing evidence on food purchasing behavior among low-income Black communities?
Okay, could you say it again? What's the name of the data source?
The USDA Food APS dataset.
Oh yeah, food apps. What's my opinion about the quality of the data? Is that the question?
Yeah, on the utility of the data.
Utility. Oh, okay. Yes. That data source is actually that data source is a really good data source, and I've read several papers. Actually, I think I briefly mentioned I'm actually working on a systematic review for healthy eating research to actually summarize what we know about food purchasing trends in the country by race, ethnicity, socioeconomic status versus urban versus rural. And a lot of those studies have utilized that data set. And because the reason why it's a great source of data is because it was designed in a way to make sure we have great representation by race, ethnicity, as well as SNAP participation status. So I definitely think that it can be useful to study differences in food purchasing behavior by race, ethnicity. I don't know how much has been published by race, ethnicity. I know I have a student who works in my lab who's working on a great paper right now looking at racial ethnic differences. But yes, there's also some methodological issues with that data as well, just because they only audited or they only collected data on 7 days worth of purchases across the households and the sample. So it only represents what they purchased in that week, and it might not represent what they typically purchase. But yes, I think it utilized as a good source to do this research. Any other questions?
Okay, yes.
We have a question.
Go ahead if you wanted to say something.
Okay.
Yeah. So
Okay.
there's also one attendee has asked, one question I have is related to increasing access to healthy foods at a low price point. Have the interventions that place a new grocer in low income areas or implement minimum stocking requirements in existing stores evaluated how price might mediate the effect of the changes in access? Just thinking about the price points at stores like Whole Foods.
This is a great question. This is a fantastic question. To my understanding, I don't know, let's see, stocking requirements research. I don't know if they've done any research looking at price differences. We did collect price data for our NOPRN project, the project where we were assessing the new grocery store in Inglewood. That's the Whole Foods, as well as the Save-A-Lot in Rockford. We did collect information about pricing. However, we did not see significant changes in price in the community, in our community with our findings, but price is something that's very important to consider. So I will talk a little bit about price points at Whole Foods Market, since that was part of the question. But so the Whole Foods Market in Inglewood, one thing that they pitched and they presented to the community was that this Whole Food Market has sort of a different structure than traditional Whole Foods markets. They set they're able to control the price of the foods at the Whole Foods Market in Inglewood just by making certain changes to their business structure, as well as the types of questions that the types of items that they stock. So the structure of the store in terms of square footage, the business plan, as well as what they stock, allows them to control price points. So it ends up, the store doesn't price itself by the community. That's the biggest concern, making sure that the prices are affordable. But there isn't a lot of great data on price that I know of.
Okay, thank you.
Any other questions?
We also have, yes, we have another one. Might it improve the diet outcome if these programs were linked to health services or programs such as the diabetes program? Has that been done, or has work been done to reach people most attuned to healthy eating for disease management?
Yeah, that's an outstanding question. I do believe that it could potentially have greater impact. So one thing that's challenging about these strategies is that, we're trying to expand healthy food retail, but outside of that, there's nothing else that's added to these strategies that targets improvements in behavior, targets improvements in helping people manage their health. So that's the thing that's, that I feel like the WIC food package revisions is a very unique situation, because again, that targeted, and it was something that was developed by WIC. But these other strategies like minimum stocking requirements, the HFFI, the goal was just to expand healthy food retail, and there was no other component to improve behavior or education or chronic disease management. So maybe partnering, like you said, with some other sort of entities that focus on doing that particular work, you might see greater impact. Yes, you might actually see some improvements in diet and as well as health if you partner or add at least some additional components to these strategies. I hope that answered the question.
Okay, and one last question. So in thinking about the food financing initiatives, can you speak to some of the challenges that some of the communities might have had when trying to, implement these food initiatives, of open these stores, or in any challenges in trying to expand healthy food retails, especially with like zoning ordinances and such?
Yeah. That's a great question. That's a question that I figured that we would get. So I actually went to a meeting in January that was sponsored by Healthy Eating Research. This HER meeting pulled like researchers from around the country who are studying healthy food retail and marketing. And that's one of the things we really talked about. We talked about some of the challenges and sort of the unintended consequences of these strategies. So for an example, I know that in the Inglewood community on the south side, the greatest concern about that Whole Foods Market opening was how was that going to affect the community in terms of the economy, housing prices, so on and so forth. And they were really concerned about, issues such as gentrification. They wanted to know how that was going to ultimately affect their community as a whole. So unfortunately, we don't have any scientific evidence to show the sort of long-term effect that these, just yet the long-term effect of these particular strategies. But yes, they have faced challenges, mostly with trying to get the community to buy into these particular type of strategies, trying to market either the program or the changes or the new store, to try to get people to come. Like we built it, we have it in place, we want people to come and utilize it.
Right. Right. And I know a lot of other cities are having the same difficulties, especially now that they're building or opening these new stores and getting folks to use them.
Yeah, definitely. I would say if you're really interested in learning more about these unintended consequences or these challenges, I would say the literature coming out of New York is probably the best. And I can recommend some papers to anybody who's interested in this topic. They've probably done the most work in this space, especially looking at specifically issues like gentrification, if you're interested in that.
Well, thank you. Thank you, Dr. Singleton, for your informative presentation on food retail, availability and accessibility in low-income Black communities in Chicago and their impact on dietary intake and health outcomes. So on behalf of the Council's Solution to Diabetes and Black Americans Core, I would also like to thank our attendees for participating in today's webinar. We will share an evaluation and video of this webinar shortly. So please look out for an invitation to our next webinar on Thursday, May 21st, entitled The Potential of Yoga to Impact the Health of African American Women, which will be presented by Dr. Bar Anderson. So have a safe and pleasant afternoon, everyone. Take care.